Hi, this is Hannah Frater, Public Health Marketing Coordinator at Tri-County Health Network. Welcome to another edition of Mental Health Matters Access Show here on Codo. This month, we'll learn more about teen mental health first aid. Like always, our monthly Mental Health Matters show on Codo highlights resources and programs available in our community around mental health. Interviews will be posted to our website at tchnetwork.org following the broadcast. We are excited to have you join us today. Thank you to the Codo News Department and Ben Kerr for making this possible. For this segment of Mental Health Matters, we are joined by Corinne Cavender. First, will you introduce yourself, what your title is, and how long you've been in the county?
Hannah. Yeah, my name is Corinne Cavender, and I'm the Behavioral Health Solutions Executive Assistant at Tri-County Health Network, and I've been in the county for about 2.5 years now.
Great. So some of our listeners have heard of mental health first aid before. For those who have not, can you describe it?
The mental health first aid is a class that we like to compare to CPR. It's pretty much how to learn the signs and symptoms of mental health challenges and then learning how to talk to someone about it and then connect to appropriate resources. So kind of just like when you're doing CPR, you're that person that kind of keeps that person going until they're passed off to a professional. Same thing with mental health first aid, is we want to be able to have these conversations, learn about what's going on, listening, and then passing off to someone who can help that person. And we have a couple different modules of mental health first aid we like to teach.
So now that we know what mental health first aid is, what is teen mental health first aid and where are you teaching it?
So teen mental health first aid is actually a new program released by the National Council for Behavioral Health. And what it is a module specifically for grades 10 through 12 to start learning about mental health in schools. So I've been going into Telluride School on Mondays and teaching seniors just in a classroom. It's 45 minutes and we do 6 sessions. And normally our other modules are longer sessions for our adults. We do either 5.5 to 8 hour classes. So breaking it up in that 45-minute class is really, really beneficial for those teens. They've been participating super well. They are so smart. And a lot of what I'm seeing or worried about stigma-wise, they really don't believe. So it's really cool. So basically, it's just mental health first aid gets our population to understand mental health, especially because we lack providers, and a lot of the providers we do have really long wait lists. So if we're all able to understand mental health kind of on a grassroots level, we're hoping it never has to get to the crisis point. So asking for help early and all that stuff, and teaching our teens just how to talk about it and that it's normal and it doesn't need to be, a big deal to talk about your mental health.
So going off that, why bring mental health first aid and teen mental health first aid to this community?
Yeah, just to piggyback off what I was just saying, is just to continue growing the mental health literacy and the mental health understanding of our community, because the more people that know, the better we are. So I like to compare it to, picture if no one in San Miguel County or any of the counties we serve, because we're going to start teaching in Youve next semester too. Imagine if no one in these counties knew CPR. Like that would be like the worst thing ever. That'd be like unheard of. We want to make the same thing with mental health first aid, of like, we all want to be able to have these conversations so that way the people that do need extra help know how to find it. And that even when we're just having a mental health kind of struggle, it's not necessarily like a full-blown challenge or an illness or anything, that we're able to talk about it and it's normal. It doesn't need to be like, really, really trying to convince someone that it's okay to talk about it. The biggest message of teen mental health first aid is to get help early, and that your friends can be a huge part of your process. So that's why we think bringing that to this community is huge. It's because we lack resources, and a lot of our resources are far away. So we can get everyone on the same page of, where we're at with mental health. It's huge and can, take a big burden off our providers.
So do the students, and do they respond well to the class?
Yeah, it seems really like they're really liking it so far. I'm getting way more participation than I imagined. Sometimes with our adult classes, it's really hard to get people to participate. And I really don't find that with the teens. given I do bring candy, so that that might be a contributing factor, but they really don't seem as scared to talk about it as I thought they would be. They also have to fill out these exit tickets at the end of class just to make sure they're doing okay. And I have them ask questions if they have any questions to ask them. And they come up with genius questions. Like, I was not that smart when I was in high school. Like, they're asking questions like, what is this based on? What's the science behind this? How many people are having those thoughts? What can I do if I don't know what to do? Like, all these questions that are honestly genius, and we try to address in the class too, so they know that their questions are being heard and answered. So I just think that these students are so smart, and I'm like so amped that they're taking it so well.
That's great. Maybe you've even learned something from them.
Oh, totally.
What's one thing that you've learned by teaching teen mental health first aid?
So hopefully I explained this well, because it's kind of convoluted, but what I've learned is, like, and this is obvious, but I've really seen it, is that stigmas with mental health are not innate in us. We are taught them. These students, they're not really kids. All of them are like taller than me and smarter than me, but they have such smart and well-rounded views on mental health that sometimes I think a lot of their parents don't have, a lot of their older peers don't have. And it's coming from, they're at like the younger generation level. There isn't a stigma about mental health. It's not until they get older that stigma happens. So having that, like, mental health conversations are only difficult because our society has made them difficult, not because they are in and of themselves. So it's really taught me that, the upcoming generations, one, are just really, really smart, and two, have a lot of hope for reshaping the conversation around mental health, because again, it's not within them. It's not in their being to be scared about talking about them. It's what they've been taught, and we're slowly unteaching those stigmas and saying it's okay. So these generations are actually coming and being like, okay, we'll talk about it.
That's great. That's so hopeful to hear. So I heard that there's a new like behavioral health coalition that you're doing some work on. What are the goals or the upcoming initiatives of that?
So is this about CTC, or is this about the behavioral solutions panel?
Oh, probably CTC, actually.
Okay, awesome. So we circled back to CTC last time when we talked about mental health first, or like mental health show in general. But what's really cool is, so the CTC coalition, which is Communities That Care, is in Telluride schools. We have teen mental health first aid in the schools, and we want to work with students and staff to just like keep growing conversations within teens. So not necessarily like, yes, it's great that I can come teach. It's great that, our CTC advisors can be in a school, but we want the teens to kind of have the initiative to have these conversations on their own without it being directed by us. And we totally think that's possible.
Mm, that's fantastic. So before we sign off, is there anything else that you'd like to mention?
I do want to mention, I just want to say thank you to Telluride Schools, Alex Jones and Sarah Kimball, for letting us come in. This is our first time teaching teen mental health first aid. So they were very gracious in letting us do so. It's been awesome to work with them and see just the growth in the students. I'm excited. We're going to teach in your Ray school next semester. I'm really excited about that. And if you are interested in having teen mental health first aid at your school, you can email me at ocbh@tchnetwork.org. Really cool. It's honestly, I was just telling a coworker today that it has been, and I've loved a bunch of aspects about my job, but teaching teen mental health first aid has hands down been the best thing I've done since I've moved here. So really excited about it.
Awesome. Well, thank you so much, Corinne, for joining me today. If you would like to learn more about mental health first aid, adult, youth, or teen, visit tchnetwork.org/mental-health-first-aid. Join us in December for our next edition of Mental Health Matters. If you're interested in learning more about our behavioral health programs at Tri-County Health Network or have ideas for a future show, please email us at info@tchnetwork.org or call our offices at 970-708-7096. Thank you so much.